Hi everybody, welcome back to another conversation with the Commissioner. It is April and it is beautiful outside, which I think is a great time to talk about and celebrate National Stress Awareness Month. So we here at the Department of Health try really hard to make sure we have as stress-free an environment as we can and to support our employees, but let's be honest, things are coming up all of the time, and there definitely could be stress. There could be stress at work, stress at home, and the two are definitely interacting. And so I'm really excited to have Cat Meyer here with me today. She is the Maternal Health Manager in our Maternal and Child Health Division to talk a little bit about stress and maybe how we can better manage stress at work. So Kat, why don't you start off by telling me about what it is that you do with MCH, and also a little bit how maybe does stress play a role in maternal health even?
Yeah, absolutely. Well, thank you for having me here with you. I'm very excited to talk about this very important topic. Maternal mental health comes up a lot within our conversations. It's the leading cause of maternal mortality, and 1 in 5 moms actually experience a perinatal mood disorder. So it's very, very common. And with that, 75% of moms then don't receive appropriate care, which is a huge number and definitely a crisis. So we talk about mental health quite often and kind of the stress that goes along with it. So when looking at like maternal mental health specifically, my team and I like to look at 3 different buckets.
Okay.
So the first one is the data. Like, what is the data telling us?
Sure.
We have a PRAM survey that goes out to not every mom, but a lot of moms, and it's a wealth of knowledge. It covers before, after, during pregnancy, so just a wide variety of topics. We're actually coming up with a PRAMs for Dad survey, so that's so exciting.
Very
We get
exciting.
to figure out. Like,
dads get stressed too.
they
right?
do.
Yes.
They do. I believe the stat for that is like 1 in 10 dads actually experience a perinatal mood disorder too. So
Wow.
it's definitely important to talk about both areas. So kind of being able to look at like that, what's happening within the household. That's what the PRAMS data will be able to show us. So that's kind of bucket number 1. Bucket number 2 is the workforce. We need individuals being trained in perinatal mood disorders, or it's never going to improve.
Right.
I think a lot of providers think that, oh, I have a mental health background, like I'm equipped to train or work with a perinatal mood disorder, and that's not always the case. So I'm very excited about this program that we've been doing for the past 4 years. We've worked with Postpartum Support International, and we have trained over 700 individuals within Indiana on perinatal mood disorders.
Amazing.
Which it's one of my like favorite
Congratulations.
things.
Yeah,
Thank you
it's
to
amazing.
talk about. So we have another one upcoming. So making sure our staff and our workforce is well equipped to deal with this crisis is so important. We've also been piloting a maternal health advocate position in 10 hospitals. So they are the ones that really front and center work with these individuals, these women who just had given birth, on like, what do you need? What can I help with? How are you doing mentally? All those, the screenings, the questionnaires. And that's been going really well.
Yeah. It's so hard to tell, is like, what am I doing? Is it within like the normal range? Am I out of range? And even, I think we almost make it seem normal that you should be really stressed. Like, of course, you have a new baby, you have other kids, you're also trying to figure out your job and finances, but that there's support and there's help out there.
Yeah, absolutely. I think that's so important. It's like, as a new mom, you're going to be stressed. Like, that's an exciting and nerve-wracking time. But then there does come a point where if you're not able to do your daily functions, then like, it's okay to say, I'm not okay and I need help.
Yeah. So data, workforce, and then your third bucket.
And the third bucket then is that lived experience.
Oh, okay.
So we have a digital storytelling platform, and we invite moms to come share their stories, and then we actually have created a subcommittee that helps with like figuring out what's going on within the communities and then creating like data to action points.
Perfect.
And it's all run by moms, and it's a really beautiful subgroup. Yeah, it's great. It's wonderful to listen into.
Well, that's amazing work. And,
Thank you.
I always think about our staff. We have a lot of people that are dealing, just thinking about the data, but the data around fatalities, just, tragic infant deaths, maternal deaths, child deaths, and I think that does bring in a level of stress, right, for people to think about that and thinking through it. It's very important that we do it, right, because we take that information and then we make action items. But I mean, how do you guys talk about stress, or do you have any suggestions for people how to deal with stress when it comes to work?
Yeah, absolutely. My team and I have been piloting, I guess, kind of a new thing that we start or end meetings 10 minutes early. So we all have very busy schedules, back-to-back meetings.
Of course.
And having that 10-minute buffer has been wonderful. Like going to the bathroom, getting a drink of water, taking some deep breaths, it's been honestly incredibly helpful, and it's something that's super easy to implement.
Yes.
We also start a lot of our team meetings out with like a grounding exercise. So we do like 3 deep breaths together, a 5-minute meditation, and that's really just helps us ground for these like very hard topics. It can definitely take a toll on somebody, the work that we do. It's all important work, but we need to make sure that we're healthy too, so we can provide for our communities and help our communities.
Yeah, absolutely. It's so important. You have to take care of yourself first. It's like what they always say, right? Put your oxygen mask on before you go to help others.
Yes.
And I think talking about it and normalizing the fact that these are hard conversations, and we're all going to deal with it a little bit differently, but it's okay to talk about that there is some level of stress. And I think your point about meetings is so, I mean, very important. In the world of Teams and Zoom meetings these days, it is so easy just to have them scheduled back to back to back to back, and you're like, wait a second, I haven't gone to the bathroom, taken a drink of water, taken a deep breath, right? In 4 hours. I mean, you can easily just kind of get in this mode. So it sounds like really intentionally with your teams to work in some time in some spaces, right? Even if you're setting meetings, like meetings don't have to be an hour, make them 45 minutes, make them 50 minutes, whatever that may be. To help incorporate some stress, or as a team, like you said, incorporate some stress relieving opportunities. I know in the ER, people are always worried about ER docs and what we see and the level of stress, and so they're like, do yoga, eat healthy, and yes, all of those things are great. I do that too. But I think it is sometimes just having colleagues that you can talk to and say, hey, I saw this bad case, I just need to kind of talk through it. And we make sure that we also, when we do deal with something tragic, set that time aside to talk. And that has such profound effects on your mental health, not just in that time, but weeks, months, and even years down the road.
Yeah, absolutely. And I think like we forget sometimes what it means to like have a team. It's like that's what they're there for, is to like lean on one another. If I knew somebody on my team was struggling and didn't come talk to me, be like, well, I'm not doing my job then. That's like part of leadership. So
and it's a back and forth, right? It's making sure people feel open to come talk to you, but you're also eliciting that, like, hey, like, do you want to talk? Do you have anything you want to discuss? Or let's just go sit, have a cup of coffee, or whatever that may be.
Absolutely. Having those check-ins is so important.
100%. So we do have the best team here, I believe, here at the Department of Health, and I think we do a pretty good job of checking in on each other. But given that it's National Stress Awareness Month, let's just make sure, meet as a team, think about what you guys are doing to help relieve your stress at work, how you guys could work together to better maybe, implement some of these solutions, and don't ever hesitate to reach out if you need help. Of course, we have 988. We also have other opportunities to engage with, state employment, et cetera. So make sure you know where you can go and work together as a team. And it was so nice talking to you. Thank you for all the work that you do.
Thank you.
Awesome. We'll see you guys next time.